very good morning for those that are just joining us. Right here, we shall be joined on Zoom by one of our panelists, and I was trying to get to terms with the technology that shall be enabling that particular interview to go ahead. And as we do, of course, we're going to be discussing the latest crisis within the health sector. And here you are, I'm onto it, understanding the ongoing doctors' strike, why health workers are always unhappy. Interesting. That's a cloud of gloom on a sector that is very, very important to public health in the country. My guest in studio is Dr. Mark Muyanga, a senior house officer at Mulago National Referral Hospital. And of course, via Zoom, we shall be joined by Elana Kembabazi, a program manager at the NGO ISA. Allow me welcome Dr. Mark Muyanga, who shall be giving us a preamble on exactly what the latest crisis in our health sector is. Good morning, doctor.
Good morning.
How are you?
I'm fair.
You're fair.
I'm fair.
I understand why you are fair. Yeah. I hope in the workings of the government, the health sector, and the doctors, you will soon be very fine.
It's our prayer.
Bring us up to speed with the latest deadlock that has seen senior house officers threaten to plunge the country into its latest public health crisis.
Thank you so much for hosting me.
And I'm sorry for being very blunt, but we must be.
But I would like to renounce the statement you've made
Sure.
that we are trying to plunge the country into
that is what the
form
government
of disaster.
sees. That's what the government sees.
No, that's what they want to see, it seems. However, back to what you asked about, first of all, I would like to tell our viewers quickly about who a senior house officer is.
Oh, no doubt, please.
A senior house officer is a fully qualified medical doctor. The implication is you went to medical school.
Yes.
Have your two bachelors, that is a Bachelor of Medicine and a Bachelor of Surgery. And thereafter you underwent internship, and after the one-year internship, you are fully licensed by the Uganda Medical and Dental Practitioners Council. And thereafter, you again decide to go back to add more skills or to specialize in a particular field. So you either do a master's or you do a fellowship. So if I'm treating children, I become a pediatrician. If I'm treating issues related to ladies, I become an obstetrician and gynecologist.
Okay.
Yes, if I'm doing simply surgeries, I become a general surgeon, and so on and so forth.
Yes.
So back to where this problem started from. Way back in October is when we last received any allowance as senior house officers. In December of last year, we reached out to the pertinent officers or the important officers in Ministry of Health. That is the Office of the Commissioner of Clinical Services, the DGS, and the Permanent Secretary. And we wrote several letters. However, we were not responded to. In January, and on January 18th, we can share with you the letters if you want.
Oh, please.
We wrote once again, and still we got no response. So we decided to go, let me say, analog. That is calling, and going unofficial, that is texting.
Okay.
But still, we were not responded to. So the last bit is last week but one. We decided to physically go to the Ministry of Health to face these people, because as leaders we were under a lot of pressure from the people we are leading.
Before you go any further, just let's be very categorical on this. In my world or sector, an allowance is different from the known amount of money that I receive for the kind of work that I do, which is either salary or a stipend, whichever way anybody seeks to call it. So what is the bone of contention here? Allowances or salary?
Senior house officers don't receive salaries.
Okay.
It's an allowance.
It's an allowance.
It's an allowance.
Wow.
Yeah.
Okay.
And that's what we survive.
There you have it, information coming through. And why should a senior house officer, given all the specialization, 2 bachelors, and then specialization after that, is not entitled to a salary but an allowance?
That's the way the system runs. And partially
This must be huge allowances.
The rationale behind that, or what they say, is because we are still studying as well.
You've
but
done
remember,
2 bachelors, you've
yes,
done internship,
yes,
you've gone for fellowship or even specialized, and
yes,
you're still studying?
I'm offering services, but while mastering. While mastering.
Wow.
However, in other countries, actually, they receive an allowance. Not an allowance, but a salary.
A salary.
And it is something we had suggested, that since, as you've also said, we are already fully qualified doctors, and we are now simply specializing. We are supposed to be basing on the system of other countries.
In other words, as you are specializing, you are working.
Yes.
The dispensation right now does not allow for one to simply concentrate on the specialization, and then after that you can come and do the work that you ought to do.
You know, I think I need to point out to you
please do.
The life of, or the day of a senior house officer.
Yeah.
Typically,
yeah,
you wake up at 6, do your ward round at 6 a.m. Then after the ward round, you either go to special clinics or you proceed and go for lectures. Then in the evening at 6, you again have to do evening ward rounds, because the condition of a patient can change at any time during the day.
That's right.
Then you may find yourself after that evening ward round at 6 that you are supposed to be on call at night, because patients usually decompensate at night. So there are times you find yourself working 24 hours. And then you find the following day again, when you have to repeat the routine, you may not work at night, but you have to work the entire day and study. A senior house officer not only does that, but is in charge of teaching medical interns. A senior house officer is in charge of guiding other lower cadre medical personnel on wards. Is in charge of teaching medical students. All that is work we are doing. So we are educating, we are working, and at the same time we are gaining
One
skills.
thing I gather from this whole scenario is that what is needed is a reform of the working relationship, or rather the nature of understanding between SHOs and either the medical council or the ministry and all the stakeholders that are responsible. You should be fighting for reforms and not striking over allowances. The reforms could be as simple as ensuring that it is changed from receipt of allowance to being entitled to a salary.
Before we go that far,
Yeah.
allow me to point out that senior house officers are responsible people.
No, I haven't
married
suggested
people.
otherwise. I haven't suggested
We
otherwise.
have children,
Yeah.
and we need to survive. So before we go to the issue of reforms, can we receive what is currently approved? In 2016, when we met the President of the Republic of Uganda,
That's right.
and informed him about all the work we were putting in as senior house officers and getting nothing, he referred to that act as modern-day slavery and ordered that we receive an allowance.
In other words, the directive hasn't been put into.
In 2021 is when we sat with Dr. Chris Bariomusi, it was at Imperial Royal, and signed an MOU stating that senior house officers will be receiving an allowance
That
of 2.5 million shillings every month, which gets heavily taxed, and you end up with about 1.8 million shillings. But imagine we have children, we have wives, we have parents and grandparents to look after, we have rent to pay, and since October, we have got nothing.
You also have husbands. Usually when people say have wives, it begins to look like the women, The doctors are also women, no doubt about that, and they have husbands. That completely changes the flip of the conversation. But earlier, as I was beginning the show, I was flipping through the phone here, and I was trying to ensure that we get in touch with Elana Kembabazi, who is the programs manager at ISA, because she was running late because of the vagaries of our traffic system within Kampala. However, we are delighted that she's been able to make it to the studio. A very warm welcome, Elana. How are you doing?
Good, thank you. And sorry about earlier. It was actually water cutting off a part of the road.
Oh, sorry about that.
It's a heavy downpour there. Infrastructure and why we are still in this situation, this era. But it was also very good for me to hear the lived realities of SHOs, because I don't think many people know that first of all you're not interns and that that you're going ahead and training the interns and you run the system. We have seen this. We were seeing the pictures from Mulago this week, and lots of us who've used particularly public health facilities are aware of the central role that you play. And I, for one, am just tired of health workers perpetually striking. I mean, someone has got to, we cannot live in this state. It's a bit of a failed state. You got COVID-19. You realize the health system is the most important. The health workers, while we stayed home and kept ourselves safe, were laying their lives on the line. And then again and again and again, it's a different, at some point you're like, which ones are striking now? But why are we like this?
Yes.
And then he talks about the MOU signed with Bariomunsi. In my head, I'm like, but where's the Minister of Health in this discussion? Why is there an MOU? It's things that are sort of done. The president is giving this directive. The ministry is not budgeting for it. You're having discussions by I'm still trying to understand why. The Ministry of Health is quiet. Even now, I was trying to go through and see, has the ministry come out in a real way to explain to us, the public, because we are stakeholders in this. It is our patients who are not getting treated. It is our monies that get paid. If they decide to go ahead and pay you, it is our money, our taxpayers' money that goes there. And no one is coming out to really explain. We're in a budget process. And we were last year. So I was trying to go back to the budget last year. Was it budgeted for? It wasn't clear. You know, last year we noticed that a lot of money was given to the health workers. Yeah, and we applauded
including improvements in salary.
Exactly, and as ISA and other organizations were like, we applaud government for that. People have been striking. I think it was 400 a month. I had my figures before me. But then you realize this very important group is saying they have not been catered for. They have not been paid money since October, which is a long time, amidst a cost of living crisis. And the fact that we even had Ebola. So it's really just adding salt to the wound.
Let's allow
I want to understand what,
Dr. Miyanga to take us through the specifics of the Memorandum of Understanding that was signed with Dr. Bariomunsi at the time, who was then Minister for Health. What was that Memorandum of Understanding? And give us the preamble to it, and then how, well, apart from the fact that you haven't been paid, what other aspects haven't been attended to?
Prior to the signing of that MOU in 2021, if you remember, there was a countrywide strike of doctors, and Uganda Medical Association.
That one covered all doctors, all medical workers.
But it started with interns actually. Then eventually all doctors joined. Yes. Following that, because they had not adhered to the directives of the president, because he had directed that doctors, a medical officer should be receiving 5 million shillings, and an intern should be receiving half of that, which they hadn't adhered to. And so there was a strike. And at Imperial Royal is where the meeting sat. There was Uganda Medical Association, Federation of Uganda Medical Interns, the representatives of senior house officers, and Dr. Chris Bariomunsi, who is the Minister for ICT, but came up to moderate because we were having issues of mistrust with our mother ministry, Minister of Health. And he was sent particularly to moderate in that process. We agreed that we would be receiving an allowance, not a salary, of 2.5 million shillings, and it has been coming since then. However, there have been instances where this money is released from Ministry of Finance, but doesn't receive the intended recipients. Mbarara University senior house officers last year, who are currently in second year, spent 6 months without receiving an allowance and started being paid after the 7th month.
When they were paid,
they've never got that money.
Did they get their arrears?
They've never got the 6 months. But this money was released. The other house officers missed 3 months and started being paid in the 4th month. They've never received this money. Now, fast forward to our situation, October, November, December, January, February is ending.
February is effectively ending tomorrow.
We have got nothing. Landlords are calling us. Our kids are not going to school. And you wake up and claim to be a doctor.
Elana Kembabazi, ISA has put itself at the forefront of ensuring that some of these ills within our public health sector are brought to light, but also done a lot of work in ensuring that the powers that be actually are put to book when it comes to either rolling out the reforms or even basically being able to meet their part of the bargain when such memoranda are signed between government and health workers. In your follow-up mechanism, what do you do and how far are we when it comes to ensuring that some of these agreements, not only with SHOs, but also interns and other public service workers, is going?
Yeah, I think a lot of what we do is around budget advocacy and monitoring, because again, these are budget issues, right? On the one hand, we talk a lot about where government should get the money, because government does need money, especially now with all the crises it also has money, but it does need more. So we always talk a lot about the need for progressive taxation and all of that.
Yeah.
But number two, more importantly, we look at the budget. Where is money being allocated? And one of our key asks has always been that the public health system must be prioritized. I mean, you post others have done surveys and they will show you Ugandans go to the public health system. It's the one place you run to. You may think because you're wealthy you don't need it, but COVID showed us you're one medical bill away from poverty. You will end up with the public health system in whatever state it is, and that is run by healthcare workers. And so looking from a budget perspective, that's why I asked at the beginning, looking from a budget perspective, you're not seeing this reflected. So they're playing a smokes and mirrors game where it looks like, yay, we are putting more money for health workers, but actually no, there's a group. And the second bit about it that is troubling are these things that are done a bit outside the system. So I'm here in Bariomunsi because of mistrust or not. The MOU should be between the government of Uganda and you all, right? But also mistrust or not, the Minister of Health should be there because at the end of the day, your health workers, you're under that docket, and they are the ones that are supposed to really manage the health of this country. And also from a sustainability perspective, for the budgeting to happen, they must be budgeting for your allowances within their budget. So the budget framework paper, the ministerial policy statements. I know that now we're about to be heading into ministerial policy statements, so this is something we continue to look after. My challenge though is that the country is held hostage when these things happen because of poor planning by government, that people wake up one day and they can't get services. Because you can't say they are wrong to strike. Even you, if you are not getting allowances, you have a family, you're working, and they work long hours, they work multiple shifts sometimes. And then the country, so this haphazard system of health governance, and I mean it's governance, but particularly in the health sector, and the failure to actually plan and budget means that people die. I mean, there are people who need to get health care who are not getting health care. There are like real repercussions here. So for us as ISA, this is definitely a very serious issue for us. And it may be that as we are continuing to monitor, I know you're in your second week of your strike, right? And to sort of see where these discussions are ending, and would love to see also the MOU in particular that set this out, because we have to think about more permanent solutions. It cannot be, you know, just by MOU, just by directive, this just can't be happening, because we also know that there's a shortage of healthcare workers in this country. And that's the thing that I think everyone forgets. People are not running, putting up their hands, please let me be a healthcare worker. I mean, and one of the, I looked at their letter, one of the demands they have is not just about their allowance. I mean, that has dominated. But one of the demands that I thought was noteworthy was they want supplies, they want things in the public health facilities. They don't want to come, and they are just, you know, you're hiring.
Right.
And that's a key demand that the public is forgetting. And that has been a thing that we know. One of the demands is NMS, we need these things in public health facilities. And we have been seeing these stockouts. We have gotten so used to them. The question I have for government and the public, why have we resigned our people to such poor health care in the public health system? Are they not lives that are worth living in dignity? Do you think you will not use the public health system?
Before we discuss the latest when it comes to how far government is responding to the industrial action, just Dr. Mark Muyanja, I want you to take us through the workings of the health infrastructure. The other day we were listening to an official from either the Medical Association, I forget the name, as he was interfacing with members of parliament and discussing this whole issue. And he spoke about the lack of tools, including switches, when attending to a patient, basically, that even some doctors at one point have to get the hands into their own pockets because of the sheer predicament one patient can be in, unable to even afford a tool that is as cheap as 5,000 Uganda shillings. When a hospital like Chirudu, Kawempe, or even Mulago, given its complex nature, is operating on a daily, tell me or take us through what the doctor goes through when it comes to, for example, heading into the operating theater. Be honest.
Yeah. Because I've been there. The first thing is you need basics. You need to protect yourself before you handle any patient. That is, you need scrubs. These are things which at times are so rare. You find a doctor putting on rags instead of scrubs when going to the theater. The second issue is the materials you need to use on the patient. And the most frustrating thing is usually absence of basics. Suture materials. Sutures are, you can get sutures at 1,000 shillings, 1,000. But you know, these conditions don't wait for you to have money before they land on you.
Sure.
Anytime you can get a problem, you can get obstructed labor. You had gone to maybe a traditional birth attendant and you get obstructed labor, they bring you and you have no coin. And the bad thing is they come in weird hours. Someone comes at 3 at night and there are no sutures. Pharmacies are closed within the town or where you are.
Where somebody can run quickly.
So you have to run around and look for these sutures, call colleagues, wake up pharmacists and do all that. But ultimately it comes down to what we talked about, where we requested that Ministry of Health and Ministry of Finance, together with Parliament, work together to try to pass a supplementary, because national medical stores reported that they were out of supplies, and this is something which happens a lot. You know, there are so many times the public accuses doctors or medical or health workers of stealing drugs, but you cannot steal what is not there.
But sometimes you steal.
That's interesting. But it's interesting. We hear those stories, of course. I don't know whether it's a particular set of drugs and tools that are predominantly stolen than others.
We have always got reports where stockouts are reported.
Yes.
Right from the level of national medical stores. Because even what it provides is insufficient. So when people rise up and say we steal drugs, now what would I use sutures of 1,000 shillings for?
No, when you get
and
them
how will I steal?
They're really huge. A container of switches can build a house.
If they were there, fine. So, but how can I steal what is inexistent in the first place?
There. All right, so that is a very gloomy picture of what happens on a daily.
Can I just come in?
Please do.
He talked a bit about, like, we're asking for a supplementary budget. And again, I keep coming back to poor planning. People's supplementary is supposed to be unforeseeable. I mean, look at the Public Finance Management Act. It has clear things about what supplementary is when you bring a supplementary.
That's right.
So you know you have health facilities. You know the health workers there. You know they should be equipped with these basics. Why do you wait until supplementary? Why do you have certain things unfunded priorities? These again are issues, and I'm bringing them up now because we're in a budget cycle. So members of parliament, please pay attention. We're not going to sit as Ugandans for another year and be like the healthcare workers, they're now striking. I don't know. There's nothing there are no such as there's
What is
no
the next course of action for the civil society?
Not just civil society. Actually, the biggest stake here for me, the people I need to be discussing on the floor of parliament are members of parliament.
That's right.
They are our voice as people. Now let's forget us as civil society. We came in to supplement and advocate and bring out the failures. But now you see the failures. The failures are there. They have been documented. Every budget analysis ISA has ever done, and most civil society has pointed out a number of these issues. Now we're in a budget process. For one, I need them to be addressed in this budget process. But two, we also need members of parliament to bring, the minister should come and give us a proper statement. What are you doing on this? I haven't seen it. It may be out there. But what are you doing on this to resolve this strike? Because we're not going to stay in strike mode. We have patients that need health care.
Doctor has something.
No, I wanted to point out something. It's that recently the Minister of Health came up and said that the reason why they are unable to get our allowances is because our numbers have increased. And I would like to interest you in the fact that the current second-year students are 260 in number.
That is at
260. The senior house officers all over the country.
All over the country.
In second year are 260.
That's across all medical schools?
Yes.
Okay. They
are 260. And remember, this is a recurrent expenditure. The current first-year senior house officers are 245, rather 247. If you had planned for 260 new senior house officers, I wonder how you can rise up and say 247 senior house officers are too many for us to pay. It doesn't add up.
You have, of course, studied, and I can presume, and please correct me if I'm wrong, that you have acquainted yourself with what happens in other countries and how the structure there appreciates in terms of the rollout of allowances, including salary, to senior house officers. Paint us a picture of how it is so that we can actually understand what the house officer in South Africa, for example, where most of our doctors are going, and even nearby Kenya, do get for the kind of work they do.
Our system is modeled after the system of Great Britain, and partially guided by the US system. A senior resident or senior house officer in the US starts with $50,000, and it is increased every year by $5,000 till they finish.
Every year?
Every year.
In other words, you're assured of that increment?
In England, it goes to at about still $50,000.
Let me be doing the math here.
Dollars per month. And still with each year, it is what? It is increased because you are adding more value to the system. You are gaining more skills and doing more procedures, serving more people. You get
50,000, that is annual salary. Is that the computation? Yes. That is 183 million equivalent of Ghana shillings. So annually, how much money do you make if the allowance was to be coming in smoothly?
Annual 1.8 by 12 million shillings. I'm not so good at this.
1.8?
1.8 by 12.
But can I come in?
Please do. Has that?
I don't think that his rationale is we want
22.
I don't think his rationale is we want $50,000.
It's not. We don't want
a different scenario altogether.
We have different GDPs. Our economies are different.
Bring us up to speed with Kenya and South Africa. That is more. It's kind of the.
I'm not so sure about the Kenyan system. Yes.
But the others get steady
But what I know is in South Africa, actually, they
the reason I'm intent on that is that many arguments are made by, for example, members of parliament who say, when you look at our counterparts in Kenya, in Rwanda, and in South Africa, they get a lot more money than we do. So stop complaining about the fact that we want more money. So in asking you that question, so the perspective can be well understood.
A basic and embarrassing thing I'll tell you is a medical intern in Kenya here gets 5 million shillings.
A medical intern?
Intern.
5 million shillings.
A senior house officer in Uganda is getting 1.8 million shillings.
That means an intern in Kenya is paid more than an SHO in Uganda?
Yes.
Elana?
So for me, like I've said, and you know, with Kenya, they also say they do need a bit more. I do think that, again, comes from what you prioritize and what you think is worth putting money in, right? You know, we see people, politicians, they'll go campaigning. They will spend so much money. And it's usually people don't think about it. Sometimes it's their money, but sometimes like if the president travels, it's actually our money.
The stakes are really high there.
Taxpayers' money that goes, because there's a whole detail that has to go with him. And you look at how we are paying our healthcare workers, and we can agree on one thing: our healthcare workers are underpaid. We don't even have to make a comparison with other countries. And if we did, we would even realize how much more they're underpaid. And that is why they've tried to leave, those who can. And I think, again, it's really about us failing to prioritize. The fact that this strike has gone on, and it's not, I mean, I think every time Parliament should hear there's a strike, they should be like, wait a minute, didn't we resolve this, bring the person? Apathy. You know, and the same thing as well with the ministry and with the governments. If you have a minister of health, if he's saying that they couldn't even sit with the minister of health, that really shocked me. And they had to deal with ICT. That just shows again that no, the lack of prioritizing and saying we need these people, because the truth is, every government official watching now, as Ugandans, we need health officers. You're not going to magically produce a health workforce in one day because, oh, sorry, these ones are on strike. I bring in troops. If you have an idea of how to do that, you should already be doing that, because there are people not getting healthcare right now. You need them. So for a sustainable public health system,
Doctor,
we need to have
what
the
have you
healthcare
been
workers
promised
paid.
by the government? I'm sure they received the letter. Has there been any feedback? And if there has been, what is that feedback? Can you share with us?
From the meeting we had in Parliament on Wednesday, where I was part, the chairperson of the health committee had agreed and promised that we would have a tripartite meeting between Ministry of Health and Ministry of Finance.
Okay.
To date, we've not got any feedback.
On that?
We've not got any feedback.
Also, when is this tabled on the floor, Parliament? I mean, beyond your sort of negotiation, as the public, you know, I think people forget we are a stakeholder in this. It is our people that are not getting health care. So when they come, they should come and present a statement on the floor. First, someone should be asking for that. It is the public can know, because we are watching this happening in our hospitals, in the news. I'm glad that I commend the chair for trying to, you know, convene you all, finance, health. But no, we need more. We need to be able to have a proper statement, and not just in Parliament, ideally to the public, about what is happening, about how to make sure this does not happen. Our healthcare system is hit by these shocks. You begin to distrust the healthcare system because you're like, will I find a healthcare work? They're striking. Because when is it? There are no health facilities. What then does our taxpayer do? Our tax monies do, rather. What do we as taxpayers get from our tax monies? Because you're coming for us to ask us for tax.
That's right.
And there's a cost of living crisis. So the only way you're cushioning the people right now is to make sure we have public services, quality public services, quality public healthcare. The plight of healthcare workers is a very important pillar of the quality public health.
All right, time is not our best ally, and I will allow Dr. Muyanja to do a wrap. At what point are you willing to halt the industrial action? And usually, we all belong to a country whose workings we know. If you met the president today or tomorrow, what is it that you're willing to take and what you're not willing to take?
As senior house officers, our stand is humble and simple. As long as our arrears are paid.
Yep.
And the necessary services or facilities or utilities are put in place by national medical stores to make our work easy, we are more than willing to go back and serve, because we get no delight from seeing our fellow countrymen suffering or dying. However, even as humans as well, we have families to look after. We have bills to pay, we have rent to pay, we have fuel to put in vehicles for the few who have them anyway. So let that issue be handled, and we shall go back to work at any time. But for now, we are honestly not in the right condition, physically, mentally, and socially, to handle Ugandans.
Is the Uganda Medical Association in on this particular industrial action?
The Uganda Medical Association, led by Dr. Edith Naku, has been very supportive, and we would like to thank them so much for what they've done so far.
Okay.
They've also made the same recommendations. And I would like to interest you in the fact that Parliament noted that this money had actually been released.
Disbursed. In other words, there is somebody who is not, or who has held on to this money and has perhaps put it into real estate so it can make some
So
more.
we are wondering who needs our money more than us.
Yeah.
The other thing is, which the minister talked about, where they said that they don't have money.
Okay.
The same committee said there is money. And that is why, if you read the New Vision of Saturday, they even want 191 billion shillings for allowances and cars. It's because they know there is money.
There is money.
Senior house officers need a total of 24 billion shillings for a whole year to do this.
Right.
That is pocket change.
Elana Kimbabazi, your last words on this.
Two things. One, health is not a political favor. The fact that you even have to go to the president, these are not political favors, they are rights. And rights require resources. And two, it's a budget process. I hope we don't get to see this process happening again. But also, as the country, whenever they say they don't have money, we have to think about how the financing of this country has been happening. We have a budget. We spend more on debt repayment than we spend on healthcare or education. So this, I think, this strike shows you how this trickles down to the regular folk. Like, you will not get healthcare if your health workers are not paid.
That's
You
right.
will not get healthcare if you don't have commodities in public health facilities. So we need our politicians, we need our members of parliament and our people to understand you must budget for a quality, and I keep emphasizing quality public health system. You're not going to just throw us whatever you can get. Oh, healthcare workers are striking, customer I can go to private. No, we need a quality public health system. So we need to see the resources, and three, we need this issue discussed on the floor of parliament as soon as possible. As Ugandans, we also want answers. We're tired of all this striking.
All right. Lana Kimbabazi, Program Officer at ISA, and Dr. Mark Muyanjo, a Senior House Officer at Malago. Many thanks for making it, and of course giving us perspective on the plight of these